Go.
Hi, my name is Grace Huey. I'm an LPN student at Bates Technical College, and today I'm going to be performing the donning of sterilized gloves and wound care dressing change. So before I go into the patient room, I'm going to look up all of the patient information. I'm going to make sure that I'm following protocol, and I'm going to get the necessary equipment, which I've already done. In 15 to 30 minutes before wound care dressing change, pain medications should be administered as needed. All right. Hi, my name is Grace Hugh. I'm going to be your LPN today. We're just going to do some wound care dressing change, okay? So I'm going to perform hand hygiene for 15 seconds or until dry. And then I'm going to put on my gloves. Alright.
Oh.
And then after putting on my gloves, I'm going to provide privacy.
Hello? Anybody here?
Okay. So privacy is provided. I'm going to make sure that the bed is all the way up. Awesome. The bed is all the way up. Alright. I'm just going to look at your identification bracelet here. So can you tell me your name and date of birth, please? Okay. Mary Smith and 916XX. Thank you. And do you have any allergies we should know about? PCN, iodine, ink, and sulfa. Awesome. We're going to make sure to make a note about that. So I have you like this. I'm just going to make it so that just your wound is showing. I just want you to be as covered up as possible. And then I'm going to put down a pad to catch any drainage, plastic side down. Alright, are you comfortable? Alright, awesome. Next I'm going to get my biohazard bag. I'm gonna unwrap it. I'm going to cuff it. After it's cuffed, I just want to make sure to set it just right like this so I can easily drop things into it. After I have that going, I'm actually going to go to the wound, and I'm going to make sure to pull the tape toward the center of the wound, making sure that my patient is experiencing the least amount of pain possible. So I'm just going to pull this tape, pull this. I'm just going to take that hole, and I'm going to observe any drainage or anything that's going on with the wound, and just roll that up and wrap that glove, just making sure to contain all the bacteria that may be there. Then I'm going to perform hand hygiene. Okay. Next, once I have my gloves on, there we go. I am going to observe the wound. So I want to make sure I look at the edges. These edges are nice and clear, defined. There's no purulent drainage or pus anywhere. There's a little bit of redness around, which might indicate inflammation, but not too much. And after observing the wound, I'm going to take an applicator that's sterile. I'm going to open it. I'm just going to make sure I'm looking for undermining or tunneling, and I'm going to check the depth of the wound. Okay. Now I'm just going to bring my hand down, and I'm going to measure this distance. This will give me the depth of the wound. 1.5 centimeters. Next, I'm going to measure the length, 11 centimeters, and the width, 2.5 centimeters. And I'm going to perform hand hygiene. All right. I'm going to put on some new clean gloves. And I'm going to get my sterilized alcohol swabs because my patient is allergic to iodine. I'm going to open them. I'm going to get one. Just go once across the edge and done. Another one. Go across the other edge and done. And then the last one and done. Next, I am going to perform hand hygiene. How you doing, Mrs. Smith? All right. Next, I'm going to get my tape out and get 4 strips because I'm going to frame the wound. So I'm going to do 1, 2, 3, 4, and then the last one, I've put my name, date, and the time so that we know when to change the dressing again. I'm going to lip my fluid now. And I'm just going to set this right here. Next, I'm going to open my sterile field. Now when opening your sterile field, you want to make sure to pull away from you. And discard of that. Next, I'm going to move this. I'm going to get my sterile field out. I'm going to get my sterile field out. And I'm just going to pinch it away from me. And set it out. And you can touch the outer inch. I'm just going to move this so that it's not near my sterile field. And I'm going to drop all of my things onto my sterile field without touching it. And I'm going to then pour my fluid into my sterile field container. And discard of that. Now I have my eyes on my sterile field at all times. I'm going to perform hand hygiene. And I'm going to don my sterile gloves on the bedside table next to my sterile field. How you doing, Mrs. Smith? Okay, so now I'm donning my sterile gloves. I want to make sure Then I'm opening, taking this, and discarding. Next, I'm going to open this, grab the edges, I'm just going to open these, making sure to touch the outer inch only. I just want them to lay flat. Okay. Next, I'm going to take my non-dominant hand and I'm going to reach and I can grab the cuff of my dominant hand. And I'm just gonna, not touching the outside of my sterile field, just gonna make sure I have this cuff that I can pull with my other hand. Now that I have this hand, I'm gonna go inside the cuff of the other hand. And I can touch it with this hand. There we go. And I'm going to take this cuff, get underneath, and roll that over. Now I'm keeping my hands above my waist for the rest of the procedure. Next, I'm going to take my gauze and I'm going to put it in the saline. Next, I'm going to wring it out and pack the wound. Next, I'm going to take my pads, my 4x4s, and put them on either side. Next, I'm going to take my ABD and just lay that over the wound. I'm going to take the tape that I've prepared and frame the wound.
You need to skip filming. She's got somebody right there. I'm not gonna be here all afternoon, so you need to get going.
And I have my initials, the date, and the time.
We're here to film, not to stand around and watch.
My wound is covered. Now I'm going to cover my patient up. Make sure your call light, so I'm going to put the lace light in your hand, Mrs. Smith. And now I'm just going to dispose of the rest of my materials. And I have that cuff. I'm going to take these off perform hand hygiene. I'm gonna lower the bed to make sure, I'm gonna put a new pair of gloves on, just to be sure. And then I'm gonna lower the patient's bed. There we go. So that's safe and locked. And do you have any questions or notes, Mrs. Smith? No? Okay, and then I'm going to unobtain privacy. I'm going to dispose of my gloves. I'm going to perform hand hygiene, dispose of all of my materials, and I'm going to document. I'm done with the skill.